My name is Kristen and I am a patient of Dr. Haddock. So I had what's called a DIEP flap. It was on my left side, and then on the right side we did an implant exchange. Yeah, so I was 33 when I was diagnosed with breast cancer. It was a surprise because I was very healthy. I don't have a family history. And so it was supposed to be pretty quick, do like the mastectomy and then a pretty quick reconstruction with implant exchange. But I ended up having to do chemo and radiation. When I was undergoing chemo, I ended up getting an infection on my left side when I had the spacers in, or the expanders in. So we had to remove the expander. So I did not have an option to just do an implant on my cancer side for various reasons. So I started exploring various other reconstruction options, and I ended up deciding that the DIEP flap was the best option for me. I was referred to Dr. Haddock by another plastic surgeon, actually. I spoke with him and several other plastic surgeons that specialize in doing the DIEP flap, but after speaking with Dr. Haddock, I believe he was the third plastic surgeon that specializes in DIEP flap. And after my meeting with him, I knew he was the best fit for me. I just felt a sense of peace when he walked into the room. He spent all the time that I needed with him. I never felt like he was rushing when he was in there. It really felt like I was the only patient he was seeing that day because he took time to answer every question. And I had a lot of questions. I mean, the DIEP flap is no small surgery. You're taking your own tissue from your stomach. And so of course I had many questions about what the surgery would be like, but also what I was gonna look like after. You can look at pictures of other patients. You know, I had many questions about what it was going to be like for me specifically. And he spent all the time that I needed to answer every question. And even after I left, I was sending messages to he and his nurse on the patient portal, and I never felt like any question was a dumb question. He just really settled my mind. The way he spoke with such confidence. You know, it was like him telling me how to tie a shoe. I walked out that day, I texted my family and friends, I said, I found my plastic surgeon. So Dr. Haddock has amazing staff. UT Southwestern is wonderful as well. So I have had just the absolute most positive experience every time I've been in here. Yeah, any staff that I've interacted with, even in my hospital stay, but here at the outpatient clinic for every visit I've been to, I've had nothing but positive experiences. So I just want to say thank you. I found you through not the most ideal circumstance, and I have no doubt that I was supposed to find you, and I'm just so thankful. Like I said, you did put me back together. I feel very confident physically because of your exceptional work. So you're a magician, and I'm just very thankful for you, so thank you. Do your research, definitely. I didn't even know what all the options were. It can be very overwhelming, just everything, all the decisions that you have to face. Just research all the reconstruction options, but ask other patients that, you know, have maybe chosen the reconstruction that you think you're gonna go with. Get their experience, you know, ask what their experience was like, but trust yourself to make the best decision for yourself. You know what's gonna be best for you at the end of the day. But once you make that decision, I would say to then, you know, seek out highly trained professionals, do your interviews with them, you know, ask them all the questions that you can, and you'll know in your gut, you'll know when the choice is right. I hope you'll pick Dr. Haddock. I would sing his praises from the mountaintops. Like what felt like maybe a little hopeless for my reconstruction, he redeemed it and put me back together, and I feel so whole, and I'm very happy with the decision that I made.